information do we need to try to balance that? And what actions do we need to balance that? So I would suggest really the most important thing is trying to get, and the only thing that will work in the long time, is trying to get as much immunity out there in the population as quickly as possible, either through exposure to the virus and natural antibodies from that, plus exposure to vaccines and natural antibodies from vaccines. Now, there are many, many companies working very diligently on trying to get vaccines up and running. Given the large number of organizations working on that, maybe we need some sort of international directory or something on keeping track of all those organizations, universities, and companies and government agencies working on that, so that we, among that plethora of vaccines that will be coming along, trying to prioritize the most likely winners so that they get through testing to make sure they're safe and effective as quickly as possible, and can be scaled up and delivered out to the community as quickly as possible. So maybe a directory would be useful, and for all I know, such a directory has already been developed or is working on by, I don't know, World Health Organization or somebody like that. But I'd suggest that's useful. But also knowing how many people have antibodies. Now, I recognize that it's been shown through testing that just because you have antibodies, it's not 100% protection. So there's a bit of a risk there in terms of letting people who have antibodies back out into society. They aren't necessarily protected, but there's a higher probability of them being protected and a higher probability that they won't be shedding, and that they're safer to be out there than a person that does not have antibodies to this. So that implies a huge effort in testing. We don't necessarily have to test everybody. We have to test a large number, and at least and repeatedly test a large number over time to see what proportion of the population has antibodies from whatever source. And in general, we can ease up on restrictions, preventative restrictions, in proportion to the number of people in the population that have antibodies to it. So I would argue that serologic testing for antibodies is actually, at this point in time, when we're now talking about trying to get the economy started again, even more important and should, in my view, have a higher priority than testing for the virus itself. And one of the reasons I suggest that, I'm not saying stop all testing for the virus itself, but one of the reasons I suggest that is therapeutic treatment is, at this point, because we don't have a specific treatment or drug specific for COVID, therapeutic treatment is now essentially symptomatic. Whether they actually have respiratory distress from influenza or from COVID or whatever, treatment is essentially therapeutic in trying to keep respiration going and treating side effects. So we don't really have to know for every patient whether or not they have COVID. We still treat them more or less the same way based on their symptoms. So that suggests to me we can maybe even put more effort into serologic tests, testing for antibodies. It's a different test technology that is in general easier to do, still requires specific reagents, antigens in the test for COVID so that we can detect antibodies specific to that antigen, to that virus. But the testing platforms are used in, I would say the vast majority of serologic tests done, millions upon millions and millions. The lab equipment and skills for that, as long as there's enough antigen reagent, the rest of the reagents are readily available, and the rest of the technology, robotic systems to process thousands and thousands of samples a day are available in everywhere. In public health labs, in private labs, in hospital labs, in university labs, not just in human health, but in veterinary diagnostics. It's the exact same technology, and there are many, many ISO registered high quality veterinary diagnostic labs, for example, that could also come into play in sampling this. You don't have to know the name and address of the person to test a sample. You just need a sample with a barcode on it, and you run the sample and the reagent specific to COVID, and you run the sample like you would any other serum sample through the same machinery and the exact same testing, just using the specific reagent, and send the results back to whomever, where it's for that barcode of that sample it had this this result, and it doesn't even have to be a dichotomous positive or negative. It can be the actual raw data from the machine, and the public health can decide what cutoff they use to declare somebody positive or negative. The labs don't need to know any of the privacy things or anything other than this vial has this number, and here's the raw results for that sample number, and let health officials merge those and give the results out. So that's something that we should look out, is to help with the huge surge capacity what's needed now around the world for testing antibodies. And when we have a better picture of that, we can more wisely know how much to ease up on restrictions, movement restrictions, and get people back to work safely, not 100% safety, but safer than we otherwise could, and get the economy going in an appropriate manner that would kind of balance risk of death through stagnated economy versus risk of death from COVID or spread of COVID. So there's some thoughts there on that issue. Hate to end on a dark note, but I think it's really important for people to realize we're not going to get back to normal if you consider last December was normal for a long time. Given that this virus can present with essentially no clinical signs, or so mild that you would never think you had COVID, you think you just had a cold for a few days, that suggests to me it's going to be able to bump around out there in the world population without detection for a very long time. Even when we get high resistance to it, it will still be bumping along there at a certain level. So eventually we might get to a point where it's kind of analogous to annual influenza, where we're doing the best we can. We treat those who get sick the best we can with as specific a treatments as we can, and we vaccinate as many as we can, and we update the vaccines to make their as effective as we can, as much as we can. But even within that, we have to realize there will still be deaths, and now there will be deaths from COVID in addition to deaths from annual flu. And we're going to have to learn to live with that to a certain extent. As more research is done and as we improve treatments for both diseases, that will get better, but we're going to have to live with that. And society, I suspect, will have to shift more to prevention in general for all diseases. I mean, the prevent measures we talked about, social distancing and coughing into your sleeve and washing your hands, those help against all infections, so they're quite valuable, but we need to increase those activities sort of in normal or peacetime, if you like, times. So this will have an impact for a long time. And in addition to the above, from trying to get the economy back and running, I mean, there will be many companies that will go into bankruptcy because of this and will never come back. Newer companies will come along, and some of those workers and people will find new jobs and create new companies, so it'll come along, but it'll be slower, it'll take time. So we have to be prepared for that kind of negative impact. Otherwise it's unrealistic. So there's just some comments on that. For the record, in addition, while I was doing my PhD in epidemiology, I also did a minor in economics, specifically production economics, and analysis of benefit cost analysis of healthcare management systems. So I don't pretend I'm not an economist by any means, but I do have some skills and at least one publication in this general area of making these kinds of decisions. So I'm not just flying off the top of my head. I do have some skills in this area. That's it for now. You can see all these videos, and the stress of prevent, detect, and protect is still true. And being an exponential superhero is still true. And we need to ease into getting the economy going again by balancing deaths, as distasteful as it may sound. You can see all these videos at Noah Metrics Research's COVID page. That's all for now. Thank you.